You're going to give me a signal. Good afternoon. Welcome to today's briefing of the St. Louis Metropolitan Pandemic Task Force. Today we're going to move through the data relatively quickly. The full slide deck that we usually present is available on the Facebook page, so you can look at it at your convenience. But we'll get on to some of the issues that we've been hearing about, and overall try to keep this a bit briefer. So first of all, this is the epidemic curve for St. Louis, once again showing the daily reports with the green bars and the 7-day rolling average. Out at the far right of the graphic, you can see that the rates have been very flat overall. And in fact, for the last week or two, we've started to see some sense of a decline. This hides a bit of a change in the demographics and the underlying patients. And I just want to remind people that right now, we have much higher rates of disease in kids under the age of 19. So particularly in adolescent teenage groups, we're seeing higher numbers of cases than we've seen before. But overall, it still appears that we're going in the right direction. Even more important, we've seen declines in the number of patients being admitted to hospitals. We had 44 new admissions yesterday, moving our 7-day average down to 53. So we're on a pretty steady, albeit slow decline. And the current number of patients in hospital has fallen below 400 for the first time in a while, with 128 in ICU and 98 on ventilators. So those are encouraging signs, although clearly there's a lot more people in the hospital than we would like. And as we'll see in a minute, there's still a large proportion that are unvaccinated. This is a new figure tallying the number of people that we've been able to treat over the last week with monoclonal antibody infusions. That is one therapy that has been clearly shown to decrease the risk of deteriorating and winding up in the hospital. And so this has been a really helpful adjunct. For every 10 to 12 people we treat, the evidence would suggest that at least one person avoids a hospitalization. So that's really good news. We're still seeing more pediatric cases than we've seen in the past, although the numbers are a little bit lower this week, 14 total, including 6 in ICU. And yesterday we discharged almost 70 patients, bringing our total to over 28,280. Again, a lot of people who we've been able to take care of and get back to their home. In terms of predicting where we're going, our models continue to suggest that we'll see ongoing declines in the number of patients in hospital. We are still at a level that's fairly high. It's very close to where we were during the very first wave of coronavirus way back in the spring of 2020. But it's going the right direction, and I think as long as we keep doing what we're doing, we'll continue to see this improve. As I mentioned a minute ago, we continue to see a high proportion of our hospitalized patients who are unvaccinated. Only about 20% of cases are vaccinated. Given a vaccination rate in the region of about 50%, these numbers would be even if vaccines had no effect, but clearly they have a big effect. Of those 20% of patients who are vaccinated but still get hospitalized, the majority of them are over 65 or have an underlying healthcare condition, which is one reason, as we'll talk about in a minute, those groups have now been approved for a booster dose, a third dose of a COVID vaccine. Vaccination rates continue to inch up. We are getting close to having 50% of the St. Louis area being fully immunized. And nationally, we have about 2/3 of citizens who've had at least one dose. So this is not climbing as quickly as we would like. And of course, as long as we're seeing large numbers of unvaccinated people in the hospital, we really wish that we could speed up progress on vaccination. So with that quick tour through the data and the reminder that you can look at the slides in more detail at your own pace, we'll move on to some of the questions we've been receiving. First is, what is ivermectin and is it safe? Ivermectin has been in the news a lot, and we are actually hearing from it hearing from patients about it in the hospital as patients and family members are requesting treatment. Ivermectin is a drug that was developed to treat parasitic infections, and it's very effective when used in acceptable doses for curing some types of parasites and worms. In 2020, someone discovered that in sufficient concentration, ivermectin would also inhibit replication of the COVID virus, at least in a laboratory. The problem is the concentrations required to do that are much higher than are judged to be safe in humans. And so it's really not panned out so far as a practical reality to give it in doses that could inhibit virus. There's been only one clinical study that was purported to show a benefit to patients given ivermectin. That study had to be withdrawn because there was evidence that much of the data had been falsified, and it really wasn't a credible study. Subsequent studies have failed to show any benefit. Currently, none of the Pandemic Task Force hospitals will administer ivermectin to a patient because there is no determined benefit, and there's the potential for reactions or drug interactions that may cause harm to a patient. So we'll continue to stick by our policy of not administering ivermectin. Second question, why is the county announcing a new mask mandate, and is it necessary? Well, the county has been solidly behind a mask mandate ever since the fourth wave started. And the reason there's a mandate is because masking is the action people can take that will help us contain the pandemic while we get immunity levels high enough to stop spread. At this point, we still have a high degree of transmission in the community. An estimated 4 to 5 out of every 1,000 individuals in the community are carrying COVID infections, and we often don't know about them because they're asymptomatic or pre-symptomatic. That's really just too high a rate to not to address. And so the mask mandate is necessary and appropriate for helping us get through this final stage of this fourth wave. The third question is, who is a candidate for monoclonal antibodies? At present, anyone who's had a newly diagnosed COVID infection can potentially receive monoclonal antibody. And high-risk individuals, those who have diseases that place them at high risk, who've been exposed to someone with documented COVID, are also eligible for preventive treatment with monoclonal antibody. Monoclonal antibody doesn't necessarily prevent infection, but it prevents replication of the virus using mechanisms very similar to what your host immune system would do. So I think anyone who believes they might be a candidate should contact their physician. Any licensed physician in the metropolitan area can prescribe monoclonal antibody infusions for their patients. The fourth question, are booster shots available now? Who is eligible? And will everybody need them eventually? Booster shots are available. Right now they are approved for individuals who have diseases that compromise their immune system, such as cancer therapy or organ transplantation, as well as for individuals over the age of 65 who are at higher risk for severe course and worse outcomes, and any individual 50 years and older who has a wide variety of medical conditions that you can look at on local public health or CDC websites. The list is extensive, and many people will qualify. In addition, individuals who are between the ages of 12 and 50 who have similar medical conditions have the option of taking a booster dose if they want. Right now, the CDC and FDA are undecided on how firm to make that recommendation, pending more data from studies that are ongoing. In addition to those groups who are at risk of potentially severe disease, it's also been approved to give boosters to anyone whose job puts them at risk for acquiring COVID at higher risk. So that certainly includes healthcare providers, first responders, and the like. Many other individuals serve in industries that also place them at risk. And once again, those industries will be available, I think, on public websites. Fifth bullet, If I get a COVID vaccine, do I still need a flu shot? We've talked about this several times. The answer to that question is yes. Influenza virus and the COVID virus are two different viruses. One shot doesn't stand in for the other. So individuals should get both shots now that we're entering flu season. We haven't yet seen an upturn in flu, so there is still plenty of time to get a shot and get your immunity level up, and we're encouraging everyone to do so. You can get the shots at the same time. You do not have to wait. There's good evidence that you will mount a good immune response even if they're given at the same sitting. Next question, are people getting confused about whether the COVID vaccine protects against other diseases? That's a question that's come up often. We really don't have any solid evidence that the COVID vaccine protects against anything other than COVID. Whether there might be some general boosting of the immune response is an open question. There are some other vaccines for which giving them seems to decrease the risk of infections, but we don't have sufficient data in hand right now to say that a COVID vaccine might make you more immune to some other disease process. And finally, well, when do we anticipate approval of vaccine for kids ages 5 to 11? The FDA currently has all the information for the first round of approval from Pfizer, and we should hear sometime in the next 4 to 6 weeks about approval. Could be sooner than that. We just don't know exactly the time frame. But my strong belief is that we'll see approval very quickly. For kids that are younger than the age of 5, there are data that are being submitted. Moderna is seeking approval for kids who are 6 months and older, and those data will still need some additional collection and analysis, and we don't expect to really see those approvals come before the beginning of next year. I realize in scanning the list, I did skip one question about boosters, which is, will everybody need them eventually? We're still figuring out what COVID is going to look like going off into the future. I think most epidemiologists and infectious disease specialists believe COVID is likely to be something that will be on our part of our lives for the foreseeable future. But we also believe that we'll get to a state that, much like flu, a simple annual booster will provide ample protection and keep people from risk of having serious disease. So we're not ready to say that everyone needs a booster, but I do believe in the future a booster will be recommended for all citizens. That concludes my remarks for today. We appreciate all the questions that are coming in and encourage you, anything that you have questions or concerns about, please submit them so that we can get them into the queue for discussion at our next briefing. With that, I'll conclude today's briefing and wish you a good afternoon.